Hey, this is Alan over at www.eglucosaminfordogs.net. I'd like to talk about Hey, this is Alan over at www.eglucosaminfordogs.net. I'd like to talk to you about how to recognize your dog's hip pain. Your dog's hip and joint pain can be caused by several factors. So many ways, in fact, that we would have to create an entire glossary of terms and reasons to line them all out for you. But instead of doing that, I've compiled a short list of the most common reasons, symptoms, and potentially dangerous treatments for you to quickly review. Let's start with the most common types of pain that your dog may experience. Hip dysplasia is the most common cause of rear leg lameness in dogs. The highest incident occurs in large breed dogs, including St. Bernards, Newfoundlands, Rottweilers, Chesapeake Bay Retrievers, Golden Retrievers, German Shepherd dogs, and many other large or giant breeds. Smaller breeds are also affected, but are less likely to show symptoms. According to statistics compiled by the Orthopedic Foundation for Animals, the risk of hip dysplasia in many of the large breed dogs presented to them for certification over the last 25 years ranged from a 20 to 40%. Hip dysplasia is a polygenic trait. That is, more than one gene controls the inheritance. Joint instability occurs as muscle development lags behind the rate of skeletal growth. As the stress of weight bearing exceeds the strength limits of the supporting connective tissue and muscle, the joint becomes loose and unstable. This allows for free play of the femoral head in the acetabulum, which promotes abnormal wear and tear. Arthritis is another cause of hip joint pain in your dog. Your dog can easily experience injury from playing, jumping, excessive weight gain versus the muscle-skeletal development. Poor diet and nutrition are also very common causes for the onset of degeneration. Falling, aging, running on non-level ground, or areas where terrain is overrun with burrowing rodents, which becomes a tripping hazard or potential leg breaker, could be dislocation of the hips or shoulders as well. Dogs with hip dysplasia are born with hips that appear normal but progressively undergo structural changes. The age of onset is 4 to 12 months. Affected puppies may show pain in the hip, walk with a limp or a swaying gait, bunny hop when running, and experience difficulty in the hindquarters when getting up. Pressing on the rump can cause the pelvis to drop. With the puppy on its back, the rear legs may not extend into the frog leg position without causing pain. Let's take a look at the different stages of dysplasia in this photo. On the left, we see normal hips, on the right, moderate hips, and in the middle, moderate hips, and on the right, severe dysplasia in the hips. You see on the normal hips, this example of a dog with normal hips, notice that the femoral head fits tightly into the well-formed sockets. Where moderate dysplasia, the femoral head is beginning to flatten out just a little bit inside the socket. And with the severe dysplasia, the femoral head is totally loose inside the socket. I mean, it just bounces around and floats. And in this x-ray, there's also evidence of hip dysplasia. You can see the right side of the dysplasia view, how loose the femoral head fits inside of that socket. Hip dysplasia is graded according to the severity of x-ray findings. And once arthritis is noted, the condition is irreversible, so they say. But even with arthritis, some dogs are not lame. The onset of lameness is unpredictable, and some dogs may go most of their lives with dysplastic hips but no lameness. Others develop lameness as puppies. Treatment of hip dysplasia is both medical and surgical. Medical treatment includes restricting activity and giving an NSAID or a non-steroidal anti-inflammatory drug, analgesic such as Rimadyl, and a joint chondroprotectant such as Adequan to relieve pain and inflammation and to repair damaged cartilage. It is important to exercise lame dogs on a leash and not allow them to run, jump, or play as long as they exhibit pain. Swimming is an excellent exercise that improves muscle mass and joint flexibility without overstressing the hips. There's 5 surgical options available. The technical factors govern the choice. I have to be upfront. We only advise surgery as a final option and under extreme cases only. All surgeries have potential risks associated with them. And besides surgery, you have pain medications, which can have the potential to cause their own damage to your canine companion. Long-term use of these remedies can cause mild to extreme damage to your pet's immune system, liver, nervous system, as well as digestive tissues and other abnormalities. You need to get the facts on ways that you can help your dog by reducing the amount of pain that they may be in. Take a few minutes to learn about the benefits of treating the problems early and naturally before you have to use more risky and potentially life-altering procedures. Stop by eglucosaminfordogs.net to get your free reports on hip dysplasia today.